Okay, we're live.
Hello, friends, and welcome to our formal debate where we will look at gift-giving behavior in the field of applied behavior analysis. My name is Hampton, and I will be your moderator for the duration of this debate. This debate will last between 30 and 40 minutes. Participants will have equal time to share their opinions, deliver facts, counter their opponent's arguments, and respond. We will have time at the end of our debate to answer questions. I will then announce the winner of the debate. Without further ado, allow me to introduce the participants. For the pro side, we have Tracy Johnson
Hello.
and Michael Santos.
Hello.
For the con side, we have Haley Hearst
Hi.
and Terri Wong.
Hello.
Tracy and Michael have completed extensive research and will seek to prove gift giving and receiving are both acceptable and ethical for behavior analysts. They will share and interpret information from peer-reviewed research articles, literature, and the BACB Code of Ethics. Haley and Terri have also completed research and will share the information they have gathered from peer-reviewed research articles, literature, and the BACB Code of Ethics in an attempt to prove that gift giving and receiving is unacceptable and unethical for behavior analysts. According to the Behavior Analyst Certification Board, or BACB's Code of Ethics, Code 1.06, due to the potentially harmful effects of multiple relationships, behavior analysts avoid multiple relationships. Behavior analysts must always be sensitive to the potentially harmful effects of multiple relationships. If behavior analysts find that due to unforeseen factors, a multiple relationship has arisen, they seek to resolve it. Behavior analysts recognize and inform clients and supervisees about the harmful effects of multiple relationships. Behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes a multiple relationship. For this debate, we recognize that gifts can be both symbolic and concrete and can be as simple as a cup of coffee, a poem, a candy bar, or a small toy, or as elaborate as a paid vacation or expensive jewelry. As behavior analysts, we are ethically responsible to provide the most effective care to our clients. Does gift giving constitute multiple relationships? Could denying a gift hinder the relationship between a behavior analyst and the client or the client's family? To answer these questions, I will now turn the floor over to Tracy.
Thank you. I would like to start off by talking about the client's compliance code 2.0, 2.02 responsibility by the RBT. Behavior analysis responsibility is to all parties affected by the behavior analytics service. Behavior analysts identify and communicate with the primary ultimate beneficiary of services is in any given situation and advocate for his or her best interests. As RBTs and BCBAs, we owe obligation to our clients. It is our responsibility to give thorough knowledge and complete competency to our clients. Furthermore, if we're trained properly, we know that gift giving is a part of our daily routine in the realm of ABA services. I'd like to go into further details about appropriate gift giving. Is it a divide created by not accepting a gift? Yes, it's a divide created. A divide is created. We're trained to build rapport with our clients. With a rapport building, we develop relationships with them and we get to know the model adaptive behaviors through probing. Probing is a term generally given or generally used in ABA service as another term for testing. And we'll get to see the client's skill level at a particular task. Then we'll establish a purpose assessment to see the positive reinforcements the client is willing to work for. With that being said, we will be the first that the clients will learn from about giving and receiving gifts. We are the first personal relationship a client builds with another person because of the rapport building stage and the trust that is formed between the client and the therapist. Scott J. Hunter, academic editor, states that in the article Supportive Relationships, the data suggests that the quality of relationship between the individual with autism and the support provider can be a critical factor with the effective support. Studies conclude that the social deficiencies, consider hallmark to ASD, including lack of cooperative play, deficiencies in joint attention and eye gazing, lack in empathetic expressions, and short enjoyment. And there's a lack of coordination of social behaviors that signal social intention. That is as a deterrent. Through effective practice, this portion is important for parents and guardians because we must incorporate the act of sharing, receiving, and giving through social skills and networking with others. In Steinberg Behavior Solution article, Social Skills and Gift Giving and Receiving, it states there's something really special in giving and receiving gifts during the holidays and preparing your special needs child with the social essentials and giving and receiving their holiday gift to and from their friends can ensure that the child contacts natural reinforcement during the holiday gift season. Gift giving is a proper way of developing a social story for children with autism and gives them a natural reinforcement because of the facial expressions and gestures that they receive from that person that they're giving the gift to. Now, how do we, as BCBA, account for the social differences in cultural competency? According to Offer Zero PhD in the article Gifts in Therapy, some are appropriate. It states that appropriate therapists give gifts to clients may include the symbolic gift, gifts that receive transitional objects, a clinical aid, therapy-related educational materials, following the social convention by giving or affirming or acknowledging gift, a supportive reassuring gift, affirmation of this relationship. And then it also states that this will be socially appropriate for clients and therapist relationships because it helps clients in and out of ABA therapy. It is a tool that is given for assistance in teaching mechanism. In the cultural aspect of gift giving, where we must be aware of what is appropriate at the time in exchanging and giving and receiving. And the article also states that the timing of gifts is important. While it's an appropriate present at termination is common. A present at the very beginning of therapy may not be, or needs to be more carefully examined. A gift following the confrontation, following the difficult session may also invite exploration or discussion. Thank you.
We will now turn the floor over to Haley.
Hi, everyone. I'm going to speak to the unethical nature of gift receiving in the ABA field. BCBAs are given their accreditation by the BACB, and we must abide by their rules. In the BACB Code of Ethics 1.06D, it states behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes a multiple relationship. The BACB does not allow multiple relationships in any capacity. You cannot be friends or have personal, private conversations that do not relate to the client, so why would you be able to accept a gift? Trying to maintain a professional, separate relationship allows for security. This security makes sure all parties involved know the relationship will be solely a behavior analytic one, and the services will not be compromised due to personal feelings. Gifts may provide unintentional benefit or extra attention to clients. Gifts, ranging from free to extravagant, should remain off limits. Is it too difficult to decide the appropriate limit? I think $5, $10, $20, or even $100, somewhere in between, it all could be inappropriate. It's extremely awkward to tell a client, I can only accept a gift under this certain dollar amount. It is unprofessional and just not necessary. We are paid for our services and gifts are just not a part of the job. Therapists have the responsibility to maintain clear boundaries. The Code of Ethics is set in place by the BACB, and it is our responsibility to set the boundaries according to the Code of Ethics, especially at the onset of services. A written document explaining what we can and can't do for the client should be given before any services start, and it should state that we cannot accept gifts or have any sort of personal relationship. This can eliminate any awkwardness that would come down the line when they attempt to give you any sort of gift. As Guthiel wrote in the Psychiatric Times in 2008, boundaries are like a line in the sand that represents the edge of standards in therapy, and crossing it can interfere with the therapy, standards, and patient. Accepting gifts can put certification and your professional standing at risk, and I personally don't believe a gift is worth losing a career over. Thank you.
Thanks, Haley. Now we'll hear from Michael.
Thank you. So in regards to accepting gifts, it is beneficial because it demonstrates two aspects. One, we demonstrate cultural awareness in accepting the gifts, and number two, it also enhances the relationship between the client and therapist. Now, in regards to these 2 points, there's 3 research articles that I looked at, and The first one being the most relevant to the ABA field, which is Wong and Associates 2016 study. Article, in which it states that we must take into account culture when we're doing assessments and providing interventions in regards to our clients. So awareness of cultural differences and similarities, especially in regards to the cultures of clients, allow for more culturally appropriate delivery of services. And we got to also take into account what treatments and what aspects of a service are appropriate for the norm of culture of our clients. And so now I'm going to look at two studies in the psychology field. The first one being Brown and Transcrude's 2008 study, in which 40 psychologists were interviewed. They were given hypothetical situations, and in one particular scenario, a Native American patient who had been dealing with loss of her mother gave a psychologist a handmade necklace. And as she's giving the necklace, she explains that the gift is given to those that help tribal members get through difficult times. And out of 40 psychologists, 38 out of 40 psychologists accepted the gift on the grounds of cultural respect and sensitivity. And for the last study, Knox and Associates 2003 study interviewed psychologists' personal experiences with gift-giving events. And in that study, therapists have accepted gifts with small monetary values, but they've placed an emphasis in labeling the gifts as symbolic items and as part of a normal human relationship. Now, those gifts were bestowed in the middle of therapy upon termination and during holidays. And the results of that study show that the gifts improve the rapport between the client and the therapist. And some examples of positive effects include positive feelings, the client feeling important, and also the event serving as a way for the client to work on the issues and dynamics within their therapy service. So in summation, we demonstrate cultural awareness by accepting some gifts of small but significant symbolic value. And doing so will enhance the relationship between the therapist and the client. Thank you.
Thanks, Michael. Now we'll hear from Terri.
In regards to not accepting gifts, we will be referring mostly to the BACB compliance code in addition to peer review articles that support the code. All right, so you have the BACB logo there. And according to 1.06, behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes a multiple relationships. Are these multiple relationships harmful? Yes. According to 1.06b, behavior analysts must always be sensitive to the potentially harmful effects of multiple relationships. Previous studies have suggested that accepting clients' gifts may be the first step onto the slippery slope into boundary crossing towards exploitative dual relationships. What is the slippery slope we're talking about? Zur 2017 refers to it as the idea that failure to adhere to rigid boundaries and an emotional distant form of therapy will ultimately foster exploitative, harmful, and sexual dual relationships. Although Zur may have stated that it could lead to sexual dual relationships in general is the same as multiple relationships, which is prohibited by the BACB. As a result, risking to accept a gift from a client could serve as a precursor to an exploitative relationship forming. Next, we want to point out that accepting clients' gifts can interfere with the effectiveness of therapy. Guthel 2008 state that accepting gifts can lead to therapists diverging from their placing their patients' needs first. As a result, one's objectivity may be clouded and compromised. Accepting a gift can affect the way a behavior analyst treats a client, and they may provide more attention or additional benefit without even realizing it. Moreover, a client may expect a favor in return for the gift. We can never be too sure about the motive behind the gift. Yes, it can be a form of appreciation, or maybe an ulterior motive. We do not know. It would be best to avoid the situation altogether. The BACB suggests this course of action in 1.06a, stating that due to potentially harmful effects of multiple relationships, behavior analysts should avoid multiple relationships altogether. Finally, if a behavior analyst accepts a gift, his or her judgment may be compromised. Bailey and Birch in 2016 provide good examples, such as a behavior analyst might feel an obligation to exercise flexibility in regards to billing, signing a waiver, or attesting to a person's good character. Overall, there's just too many risks involved with accepting clients' gifts. So it would just be best, just as the BACB state in the compliance code, to not accept clients' gifts. Thank you.
Thanks, Terri. Michael, would you like to respond?
Yes. Now, in regards to the slippery slope argument, the rigid boundaries and the slippery slope argument are unreasonable in that they associate any non-romantic relationships as romantic, and the slippery slope argument offers a skewed view of any other actions as boundary crossing. Now, the problem with setting a boundary of non-acceptance of gifts is that it will have an effect on the client-therapist relationship. And we got to keep in mind that clients have a right to a therapeutic and welcoming environment and setting. And to reject any gifts creates the image of a cold, distant relationship and can have negative effects in therapy. And we got to keep in mind that rapport and building a connection with a client are important, and we have that duty to conduct treatment that is culturally sensitive and culturally adaptive. And according to Zur, in some cultures, giving a gift is a way of expressing gratitude, and rejecting gifts, is a way of expressing gratitude. And now, rejecting gifts may come across as being disrespectful and might instill some rejection towards the client. Now, if we take a look at the APA multicultural guidelines, professionals are encouraged to come up with culturally centered interventions. Professionals are encouraged to keep in mind culture, especially in regards to the client and therapist relationship. And referring back to Zur and Knox and Associates study, accepting gifts show warmth and are welcoming, and thus it enhances the therapeutic relationship between the client and the therapist. Thank you.
Thanks, Michael. Terri?
All right, so we do not have to accept gifts in order to express cultural sensitivity. We can do so through building rapport with our clients and caregivers. As it may be that in some cultures, refusing a gift would be considered rude or offending. This is usually in regards to a guest coming into the house. We are not guests. We are compensated, and it is our job to come to our client's home or school to provide a service. Do you provide gifts to plumbers or electricians that come to your home to do work or repairs? No. So why should we be treated any different? To prevent any uncomfortable situations from arising during the onset of services, we should make clear the boundary with our clients and their caregivers. Indeed, it may be awkward to not accept a gift, but it's definitely not worth losing your credential or job over. The compliance code is put in place for a good reason, to protect our practitioners and our clients, and should not be disregarded for convenience. Thank you.
Thanks, Terri. Now we'll hear from Tracy.
I think the act of gift giving through ABA services gives parents and guardians a direction as to how they can apply gift giving into their everyday lives. And if it's not performed or if it's not taught, how can we teach or how can the parents or guardians learn how to appropriately teach their children or their child to appropriately give and receive if not taught? And if a parent does not have any direction, they cannot learn or be prepared. And it's not only detrimental to our clients or the person that we're giving the therapy to, but because we're not just teaching the clients themselves, we're teaching the family as a whole. And that act of gift giving is not something that should be frowned upon because we're looking more as in the therapy basis. Outside of that, yes, it's as applied to the code, we're not allowed to accept gifts. But when we're in the moment or we're in the therapy sessions, I think the transitional gift, a clinical aid, a therapy-related educational materials, following social conventions by giving or affirming or acknowledging a gift, or a supportive, reassuring gift, which can be assessed by doing a precedent assessment, is an act of gift giving. And I think that's more important than the act of giving a gift outside a session. Thank you.
Haley.
While it is very important to be culturally aware and sensitive in all facets of life, but it's especially important when it comes to our career in applied behavior analysis. Most clinics serve diverse groups of people, including a wide range of races, religions, income levels, etc. There are many other ways of showing cultural awareness and respect other than accepting gifts. Many clients I have worked with are very accepting of questions and would rather have you ask than wonder or infringe upon their culture. Also, if you inform them before you start services, the issue of accepting gifts can mainly be avoided. Your career has to be the main guiding force in your decision to not accept gifts. Gift accepting can ultimately lead to the dual relationship or a conflict. Just because some psychologists or other professionals, such as doctors in the articles quoted, just because they accept gifts doesn't mean that they should or we should. It is clearly stated in our code of ethics that one should not accept gifts, and it is a non-negotiable. We should respect the group that gives us our licensure. Thank you.
Thanks, Haley. Now we will have some questions. The first two questions will be for Tracy and Michael. How would you avoid aversive consequences that could potentially occur if you accept a small gift from a client? For example, what happens if a parent gives you a gift that you accept, 6 months later decides that they are unhappy with services and starts to seek out retribution?
I think it's important that once we look at the fact that they gave us a gift 6 months ago and they're trying to seek retribution now, is that they're not happy with the services. And I understand the fact that gift giving can be that fine line of being employed or unemployed. But from a therapist standpoint, we all know that the code it says that we're not allowed to accept gifts. But from a therapeutic standpoint, when we're with the clients, the person that we're working with, that's more important than receiving a gift that was seeked out 6 months ago and you're seeking resolution now because your child is not performing up to the test that you would like to. I think that's what we have to look for and look to understand where's that fine line.
Sorry,
Okay, it looks like the next question for you guys is, when a client offers you a small gift as a token of appreciation, is it possible to deny the gift? Oh, oops, I'm sorry, wrong line. Are there gifts that you would consider unacceptable? If so, how would you determine what is acceptable and what is not?
So I'd like to answer that. So referring back to Knox and Associates, gifts of a small monetary value are okay, and gifts that are of a large monetary value, that would not be acceptable. Now, in regards to determining which gifts are acceptable or not, we have to take a look at the goals that we're trying to establish, especially in regards to social skills, and we have to keep into account what skills are being worked on and what value the gift, what significance the gift will have.
Next questions are for Terri and Haley. When a client offers you a small gift as a token of appreciation, is it possible to deny the gift without offending the client? If so, how?
Yes, I would say that it is possible. However, they should have been given a list of services that we will and won't provide at the beginning of services, and this should detail our policies, including gift giving. They should be told from the onset of services that we will be unable to receive any gifts. If a person attempts to offer a gift, we can be kind and respectful, but still refuse the gift. If you provide them with the document at the onset of services, you can provide another copy at that point for reference. It can be uncomfortable to deny a kind gesture, but your career has to come first. You can still be kind and gracious without accepting the gift. Thank you.
Thanks, Haley. How can we avoid sharing, exchanging, and giving during therapy sessions when reinforcement is a goal placed by the BACB and applied behavior analysis?
I believe that it's two separate things. Yes, it is true that we can teach gift giving through social stories and teach why and when it is appropriate to give gifts. But again, we are uncertain behind the motives of the gift giving from parents, that it would be best just to avoid it. And we can teach sharing and exchanging and giving in contrived situations within the context of a session.
Great. This question is for everybody. Do you have any personal experience related to this topic that you would like to share?
I do, and
Michael,
I'd like
go
to
ahead.
first. Okay, thank you. So, for one of the clients that I've worked with, the first 8 weeks were about building a rapport. And during the first 4 weeks, there's been a lot of escape behaviors and a lot of tantrums. And on the 6th week of working with a client, after doing the preferred activity with a client, the client during his free time made a paper hat and told me to told me that he made it for me, and for me to wear and take it home. And that to me was a sign that I've made some progress in building rapport with the client, for the client to think about making a paper hat and giving it to me as a gift on my way out of the house. Thank you.
Okay, I have a personal experience that I would like to share. So I encountered a family that would present, I wouldn't say small gifts, but, gestures like throughout session, such as, maybe like a bottle of water or, cookies and whatnot. And I mean, for me, I would kindly, refuse and say, no, I'm fine. I'm all right. But a lot of when I would do overlaps and whatnot, there were some therapists that would go for these small gestures, which I believe in some sense it can be okay every once in a while. But I mean, then again, it's like you accept it all the time. And it got to the point that when they were engaged in like small talk with the parent, it was close to one of the therapist's birthdays. And so the mom, she was like, oh yeah, I'm going to make you some pozole. And I don't know if you guys know, but it's a dish that you make for special occasions. And then at that point, this particular therapist was like, no, it's fine. It's okay. But she was like, no, you're here all the time. It's the least I can do for you. And so at that point, you see this kind of like snowball effect and this like slippery slope that, yeah, okay, I may accept, a bottle of water here and maybe a cookie there and it's fine. But then it's that boundary is already crossed. And so the parent is going to actually pushed on the therapist, like, okay, of course I'm going to do this for you. You're here for my kid. You always do so much. I'm going to go and make you some. And anyway, so when it came her birthday and she was in session, she ended up, yes, pozole was made. And about like maybe half an hour of the session that was supposed to be dedicated to therapy was dedicated to, celebrating, my coworker's birthday, which is definitely very unprofessional. And it was very inappropriate, in my opinion. And it's hard to, once you cross that boundary, to go back from that, and especially when you say like about the whole like building rapport and whatnot. And then so it's just like, in some sense, you're more than just a therapist. You take on this more casual role somehow because you're there all the time and you accept all the gestures. And then in the end, you're not professional anymore. So that's why I would stay away. So.
Thanks, everybody. This concludes our debate. We have heard powerful arguments from both sides and addressed many issues regarding gift-giving behavior in the field of behavior analysis. This topic was both intriguing and challenging. Our group enjoyed researching the topic, discussing both sides, and debating. The winners of this debate are from the con side, Haley and Terri. Their reliance on the BACB Code of Ethics and delivery of arguments, as well as their rebuttals, solidified their spot in the winner's circle. Gift-giving behavior in the field of behavior analysis constitutes a multiple relationship and is thus unethical. As behavior analysts, our obligation is to deliver ethical and effective treatment, and that outweighs the benefits of accepting gifts. We would like to thank you for taking the time to watch our debate and wish you all luck as the semester comes to a close. We hope the information we shared will be both helpful in your careers and serve as a talking point with your colleagues. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.